Hello, everyone. My name is Charles Burant. I'm a professor of internal medicine at the University of Michigan. I'm an endocrinologist by training, which means I take care of people with diabetes and related problems. My research interest is actually in diabetes and obesity. I'm also the director of the A. for Taubman Medical Research Institute, which is sponsoring today's TEDx talks. Joining me today is Kathy Collins. Kathy is the Associate Dean for Physician Scientist Education and Training, and she's a professor of internal medicine in the microbiology and immunology section. She's an expert in HIV biology, and she's also an active member of the Taubman Institute, and she serves on our executive committee. In addition, Kathy is a member of the American College of Clinical Investigation and actually is the editor of the JCI Insights, the journal of the American Society of Clinical Investigation. The Taubman Institute was founded in 2007 by A. Alfred Taubman with the intent to accelerate the efforts of physician scientists to understand and treat disease. Now, physician scientists are people who have standard medical training, but also have decided to take additional training to make research a central part of their careers. Historically, physician scientists have been the driving force in biomedical research, but many people don't realize that we're right here in the buildings that you see every day. And in fact, a lot of you who see a physician at the University of Michigan may not realize it, but a lot of them also are physician scientists. In fact, there's probably around 500 physician scientists at the University of Michigan. These men and women have one thing in common. They have curiosity and drive to understand how disease works, and also with the goal of trying to turn their research findings into prevention or treatments of disease. There are some examples that you probably don't realize. Physician scientists have made fundamental discoveries in the receptors that actually form the proteins that bind to about 30% of all the drugs that we take today. The physician scientists also discovered statins, which are used for lowering cholesterol and has led to a reduction in about 50% of heart attacks in this country since the 1980s. There's drugs that reduce the deadly cancers. We have a much higher rate of cancer treatments and cures. And other things such as prosthetics and other devices that have been used to improve people's lives. Career. Unfortunately, this has shrunk now to about 1.5% of all physicians are engaged in research as a part of their career. And really, this becomes a serious threat to the continued advancements in biomedical sciences. So we need a new pipeline of people. And luckily, we have with us someone who's facilitating that. So Kathy Collins, as I said, is the MD, PhD, but she also leads the Medical Scientist Training Program, or Mstp program at the University of Michigan. And so, Kathy, I was hoping you could tell us about the Medical Scientist Training Program at the University of Michigan.
Yeah, thank you for that introduction, Chuck. And I would be delighted to tell you about the University of Michigan Medical Scientist Training Program, or MSTP, as we call it for short. The MSTP is a combined MD and PhD program. And at the University of Michigan, our program was established in 1985. Across the nation, there are about 45 of these programs. We happen to be funded through the NIH, and most programs that refer to themselves as MSTP do receive fundings from the NIH. And our program is a pretty good size. We have about 100 students spread over the 8 years during which they're in our combined MD PhD training program.
So Kathy, tell me.
Yeah.
Sorry, tell me, so what does it take to get into the MSTP program if people have interest?
Yeah, so the people who have interest are particularly those students who are interested in a future career in academic medicine with a focus on basic and translational research. If you're interested in really applied clinical research like drug trials, that wouldn't necessarily be the goal of a typical MSTP trainee. You'd still want patient care to be part of your life, but mainly the way that physician scientists think of their clinical training is a way to direct and inform their research. Trainees who are admitted into our program get funding to help support the cost of their training. And the way it's structured is similar to PhD training, where a stipend and the tuition is provided by the program. Students typically enter and do the first 2 years of medical school and then take a leave of absence from medical school to complete the PhD portion before returning to complete the medical school training. The PhD can be earned in really any field that's relevant to medicine. So we have trainees in our program who are studying, of course, biology, but also anthropology, biomedical engineering, history, and epidemiology. But when you complete the 8 years of training, you're not done. Once students graduate, they typically go on and do more clinical training in a residency program and often subspecialty training in a fellowship. So the training really is a long-term commitment. When they're done, most of our trainees take faculty positions in clinical departments of a large medical center, spending more than 50% of their time doing basic or translational research. If you're interested in applying, here's what you do. You apply through the centralized American Association of Medical School Service, or abbreviated as AMCAS, and you just indicate that you're interested in the combined degree program. Research is a really critical piece of the application, of course, because we look for people who are really excited about doing research. But you also have to be an outstanding student. The median GPA is about 3.75, and the median MCAT score is about 518. And you need to show that you have an interest and aptitude in clinical medicine. And this is usually obtained by doing volunteering in a clinical setting. If you're not sure whether a program like this is for you, you can take a couple of years off and do gap years, full-time technician in a research lab, or get into a post-bac program. Lots of our students take this path.
Thank you, Kathy. I know some of the students viewing this video have aspirations for medical school, and I want to encourage you all to consider joining what I believe is a most fulfilling career of being a physician scientist. So what can you do to prepare yourself? As Kathy has said, that there's certain things that are expected for individuals who want to start an MSTP program. But getting research experience is really critical. And so you should join a lab. And you can do this by joining the Undergraduate Research Opportunities Program, UROP program at the University of Michigan. You can talk to your professors after lecture. You can send out emails to people who do research, and you might have interest in the kind of research that they're doing. I also encourage you to attend talks. This is one of the greatest research institutes in the world, and there's talks going on probably every hour of every day. And as part of your undergraduate training, I would encourage you to seek some of these out. And with Zoom, it's a lot easier to do than it has been in the past. As a citizen, I think you need to make your voice heard. I think you need to encourage your representatives to understand that there's a need for biomedical research. And there's nothing like a pandemic to bring everybody to awareness of the importance of really strong and robust biomedical research. And finally, I'd encourage you to participate in research yourself. A lot of classes will have the opportunity to do research. Psychology classes are the one that always comes to mind. But there's thousands of clinical trials going on at the University of Michigan. And normal individuals are always wanted for these trials because we always need normal individuals to compare to people who are affected by different things. And you can learn more at umhealthresearch.org. And we'll put up some websites for the Taubman Institute for the Mstp program for umhealthresearch.org. So you can write these down and investigate further. We're happy to answer any questions that you have. Have a great day.